Hello and welcome to News 9 Digital with me, Adarsh Vepachedu. Now, the dreaded coronavirus is here to stay as you know it. But as they say, life must go on, but safely. And with that very motto, countries across the world, including India, are unlocking phase by phase. With Unlock 4.0 coming into effect in the country, metros and buses across metro cities are set to resume operations. Now, this begs an obvious question. How safe will it be for you and I to take that metro to our destination? While the centre has announced standard operating procedures for the graded commencement of metro trains with the expected social distancing norms, contactless payment, usage of face masks and thermal screening, a new study published in JAMA Internal Medicine in the United States can prove to be significant for us. This study noted that one person went on to infect 23 out of 67 passengers in a bus. To discuss more on what this study could mean for us, we have with us Dr. Vivekanand Jha, a virologist and public health expert, joining us live from Delhi. Many thanks, Doctor, for taking time out from your busy schedule to speak to us. My first question, this study published in the Journal of the American Medical Association has clearly indicated as to how quickly and easily the virus can spread in a closed space like a bus or a metro car. How safe will it be to take a metro? Will you take a metro ride? In that, are you happy with the kind of standard operating procedures released by the government? Just a reminder, metro services will resume in your city, Delhi, on the 7th of this month. Your take, Doctor.
Thank you, first of all, for inviting me. And let me just correct you that I'm not a virologist. I'm a public health expert, but not really a virologist. Now, coming to the specific question, I think this is a matter of concern in the minds of a large number of people. The paper you described was published recently, but really describes an event that took place before the world became aware of the COVID pandemic, and even China became aware of the pandemic. So this event happened in the month of January. And the single individual that seems to have infected a large number of people was asymptomatic at that time when this transmission took place. So why this is important is that at that time we didn't know about it. There were more than 60 people in that single bus. Yes. We don't know how big that bus was. So possibly people were cramped, just like we see in our buses quite often in small towns. So there was no social distancing. Nobody was wearing a mask, and there was very clear recirculation of air going on in that air-conditioned bus. So these are a few situations that we should remember. Now, we know much more than what people did at that time. So universal masking is now something which is thought to be so critical for preventing the spread of coronavirus infection, and whether the same kind of distribution can take place if people are fully masked is not something we know the answer to. Secondly, of course, there will be more distancing now. It's relevant to point out here that the study from that particular incident suggests that people were as equally likely to be infected no matter where they sat in the bus. So that might indicate that distance doesn't matter. However, the amount of recirculation of air in a closed, confined place like a metro car is going to be important, and I'm pretty sure that full recirculation will not be taking place in metros. In terms of the specific buses, most of our city buses really have open windows. So having an open window really helps in preventing such transmission. The fact that COVID can spread very quickly in confined spaces with no ventilation is well known. I'm sure that the authorities, etc., have taken note of all of that and will have in place appropriate measures. But for sure, this is not something which is zero risk situation. So people need to really make a judgment on if they can take any alternative means of transport. For example, those who can walk should walk. Those who can take other modes of transport which doesn't get them into confined spaces would be well advised to take those modes of transport.
Now, Doctor, you were speaking about how the circulation of air is quite important. When we talk about that aspect, we can obviously discount the buses because you have quite a bit of ventilation. But again, drawing your attention back to the study we were just discussing, the researchers noted that the culprit for spread of virus in, at least in this particular bus, was recirculated ventilation systems, and people even 7 rows behind the infected person caught the coronavirus. Now, when we talk about our own guidelines, they clearly say that intake of fresh air in air conditioning system to be increased to the extent possible, unquote. This is the guideline given out by the center. So how important is this, and shouldn't we ensure that there is no recirculation of air whatsoever and maximum air exchanges at that point in time?
Oh, absolutely. There is no doubt about that. That we should maximize the amount of intake of fresh air to the extent, and that's why the guidelines say to the extent possible, because different air conditioning systems have different levels of ability to prevent recirculation and have intake of fresh air. There is no way to mandate that it should be X percentage or X times and so on, because it all depends on the ability of the air conditioning system. So how much it will be affected honestly remains to be seen, and we will get to know very soon how much of it is working. So like I said before, it's not completely risk-free. There is definitely a certain amount of risk in reopening any of these services, and we need to make a careful risk-benefit analysis. That needs to happen at all levels. That needs to happen at the level of the system, which the government is doing and which the local authorities do. But it also needs to happen at the level of individual. So at the level of individual, we are responsible not only for our own protection, but also for protection of our fellow citizens, whether they are in the metro car with us or whether we live with them. So people who have any symptom that suggests that they could be having coronavirus infection or anything that resembles coronavirus infection will be well advised not to take the metro. Will be well advised to everyone will be well advised to follow the appropriate medical advice. For example, hand washing, use of sanitizers, etc. And universal masking. I can't stress enough the value of universal masking because now the evidence is overwhelming that that's one of the single most important factors that can prevent or protect an individual from getting the infection, and also prevent that infected individual from spreading the infection to quite a significant degree.
Now, at this point, I'd like to give a small tip for our viewers, and I'm sure, Doctor, you'd also be on it. Now, suppose you're in a car, you can ensure that the air conditioner is switched to the mode where fresh air is brought in instead of the default mode that recirculates the same air inside the car. This is one thing that we can keep in mind the next time we're getting into our four-wheeler. Now, Doctor, my last question to you. We have seen COVID spread in flights. We've seen it happen in restaurants and offices as well. So, is the spread of virus in a metro train or bus inevitable? What should we be doing differently to ensure that is not the case? Once unlocked, we can't really look back, can we?
Well, yes, I think unlocking is inevitable. If not today, then tomorrow at some point we have to unlock. We have to start unlocking. I think it's very clear that normal life, to the extent possible, must resume, even if it is slow. So we will need to start taking public transport at some point. As I said before, we are always taking a very careful risk in doing whatever we do, in all walks of life, right? I mean, whatever we do, when we cross the road, when we take anything, any bus, even in a non-COVID time, there is a certain amount of risk involved in everything, right? But we assume that risk because we think that the benefit is much, much greater. And we have to minimize that risk. That is why we make everything safer, we wear seat belts, etc. So in this instance also we have to follow the same principles. Now, the specific point you made about our ability to prevent recirculation in our cars,
Yes.
please do remember that that doesn't eliminate recirculation altogether.
Okay.
It reduces the amount of circulation, but and increases the intake of fresh air, but that doesn't go down
But
to
that
zero.
certainly is
And
one
this,
thing which is in our hands, which we can do.
absolutely.
Yes. Yes, doctor.
Absolutely, we should do so. Exactly. So the same way we should do whatever we can to reduce our risk and the risk of our fellow citizens from getting this, which is universal masking, making sure that we wash our hands, we don't go around touching things that we are not sure about whether they are infected or not. And if we don't need to travel, we should not travel. If we don't need to go to a confined space, we should not do that. This is not only for our own protection, but is also responsible behavior that protects our fellow citizens.
Many thanks, Dr. Vivekanand Jha, indeed, for joining us on this broadcast and for throwing light on this very important and pertinent subject as to how we're looking at Unlock 4.0, as to how we're looking at metros and buses that are all set to ply across the country, across major metro cities, and as to how a study coming in from the United States has clearly indicated that in closed spaces, the virus can spread quite actively. So yes, we have a bunch of standard operating procedures laid out by the central government, but a lot is in our hands as to how responsible we are when we travel. And yes, in the doctor's own words, try and avoid traveling as much as possible. Try to walk to your destination if that's an option. Always cycle or even use your two-wheeler, and be solo on that two-wheeler. That's really the way to go about it. Try and avoid your metro rides or bus rides as much as possible. And if you do, make sure there is social distancing, make sure you're wearing your mask, and keep your hand sanitizer in handy. If you like the information that we have shared with you, do not forget to like, share and subscribe to News9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.